Hello class, my name is Sayda Major and I will be discussing credentialing and privileging process during this lecture. Some of the questions that will be discussed in this lecture include: what certification options do you have and which ones should you take? What is the process that you must follow post-graduation in order to practice as an AGA CNP? How long will it take to get your AGA CNP licensure? How long will it take to get your AGA CNP certification results? How long will it take before you can begin working in a new job as an AGA CNP? And can you begin orientation as a new AGA CNP before you actually have received your license? What certification options do you have and which ones should you take? Currently there are two certifying bodies. One is the American Association of Critical Care Nurses, AACN, and the second one is the American Nurses Credentialing Center. The American Association of Critical Care Nurses is not widely accepted throughout the United States. There are still 1 to 2 states that do not accept the certification. This is changing, however. The American Nurses Credentialing Center, the ANCC, is what we recommend. It is accepted in all states. It is computerized with video monitoring, has multiple choice questions, around 200 questions. 25 are practice questions and 175 are scored. It takes around 3.5 to 4 hours to complete the test. You get your results right away. It includes pictures of x-rays, dermatology, lab interpretation, drug overdose questions, research principles, health policy, among many other questions. Postgraduates say the certification exams are very similar to our test at UTA. What is the process that you must follow post-graduation in order to practice as an AGA CNP? You apply to the Texas Board of Nursing for licensure, and you also apply for prescriptive privileges. The Board of Nursing will assign you a prescriptive number. Without this, you cannot prescribe anything. With it, you can only prescribe dangerous drugs. You need a DEA to prescribe scheduled drugs, but you cannot get a DEA without the prescriptive number. You can get licensed without certification. The school will send a verification of education form to the Board of Nursing. At the same time, you apply to the ANCC for your AGA CNP, and that process can start at the same time you're applying for licensure. You can sit for your exam without graduation. Transcripts must be sent to the certifying body after your degree has been conferred, which usually takes a couple of weeks. You can mark on the application to send the results to the BNO directly. Once all of the above is done, you are licensed as an AGA CNP in the state of Texas. Once you have your license with the Texas Board of Nursing prescriptive number, you can create an account with the Texas Medical Board website so that you can request the physician who will be your supervising physician in practice to delegate the prescription of dangerous drugs and scheduled drugs. Dangerous drugs versus scheduled drugs. Mark both unless your physician does not want to delegate both to you. Only do this if you have a job and a delegating physician. If you change jobs or delegating physicians, you have to terminate that relationship with that delegating physician because there is no longer a relationship or delegation to you. Remember, physicians must report to the Texas Medical Board who they are delegating prescriptive authority to, and this is the mechanism in which this happens. You cannot do this until you are licensed and need a prescriptive number. What is the process that you must follow post-graduation in order to practice as an AGA-CNP? Once you have completed the Texas Medical Board process, you can apply for your DEA. This can be done online, and the website is provided here. The cost is about $700 to $800. If you work for a public or a state institution such as Parkland or UT Southwestern, the fee is waived. However, you cannot use it outside of those particular institutions. Can you have more than one DEA? Yes, you can. The Texas Board of Nursing prescriptive number versus the DEA number. Texas Board of Nursing prescriptive number is required before you can prescribe anything. Does not solely allow you to prescribe scheduled drugs. DEA is required to prescribe scheduled medications. Hospitals require you to have a DEA to write scheduled drug orders and have to grant you the privileges to do so. Let's test our knowledge. An AGA-CNP is currently looking for a new job. She was laid off from her job and was given 3-month severance. She has a current Texas Board of Nursing prescriptive number and a current DEA number. Can she prescribe dangerous drugs or scheduled medications? The answer is no. She can't, because she doesn't have a delegating physician that has delegated those actions for her. Most likely the prior delegating physician has notified the Texas Medical Board that he is no longer a supervising physician and he is no longer delegating those actions for her. So the answer is no, she cannot. Once you have your DEA number, you are completely set to practice unless you are working in a hospital setting. Then you will need to complete the credentialing process. If you are working only in a private physician's office, you can begin seeing patients once you have your AGA-CNP state license, the Texas Medical Board prescriptive number, which is required to prescribe, and you will need a DEA to prescribe scheduled medications. Questions and answers. How long will it take to get my AGA-CNP licensure? Usually 2 to 3 months. How long will it take to get my AGA-CNP certification results? 2 to 3 months. You know right away if you pass the test, but the actual get the certification is 2 to 3 months. How long will it take before I begin working in my first job as an AGA-CNP? 2 to 3 months. Can I begin orienting at my new job as a new AGA-CNP before I actually have received my licensure? Only as an RN, this is a huge gray area. Credentialing and privileging. What is credentialing and privileging? Credentialing and privileging is the process of authorizing a licensed and a certified healthcare professional to perform their scope of practice for patient care services. Privileging is evaluation an individual's clinical qualifications or performance. Can they do what they say they can do? Why is it important to have privileging? Because it will allow you to be able to practice as an AGA-CNP. Can I do tasks without privileges within the domain of an RN? I would say no. Most privileges have domains of RN that an RN can do. I would ask for those privileges before I would do them. Just because you know how to do an IV as an RN, and doesn't mean you can do it as an ACNP or an AGACNP, because you have to be granted privileges. You have to show that you can do that skill before you can do it as an AGACNP. So I would say no. What places require privileging and credentialing process? Any hospital setting, any hospital institution. What is the medical staff office, and what is their role? Medical staff office is a group of people that collect all kinds of information about you, your licensure, they want to see your diploma, your from UTA, they want to see the clinical hours you've done, they want to see how long you've been a nurse, do you have malpractice insurance, have you been sued as an RN, and they make a file for you to determine if they get a file for you, and then they present it to a medical staff committee to determine if your credentials are in proper order and are the privileges that you are asking for, if you are capable of doing them. Then you get the okay, and then you are able to practice as an AGACNP. How long does the credentialing process take? Depends on the institution. Some institutions it can take a month. Other institutions can take up to 6 months. Can I work in a hospital with my doctor supervision without completing this process? I would not recommend it. The answer is no. What do I have to do to apply for privileges? You have to get an application for privileges, and you will check off things like core privileges, things like I want to have privileges for lumbar punctures, I want to have privileges to do peripheral IVs, central lines, paracentesis. There's a big form that tells you the core privileges, and then additional privileges like dropping in a Swan-Ganz catheter, intubating someone. You would ask for those privileges. With that, however, you have to show that you have the skill to do it, and just do it in the lab isn't enough. So most of the time, certain skills you don't ask for until you're actually in the workplace, get the experience to do it, and then you go back and ask for those privileges. Is there a fee associated with the application? Most places there is a fee. It's like $25–50. But if you're going to be working at that institution, it's waived. There are some cases where you work, for example, at Harris Methodist downtown. They're hiring you. You don't have to pay the fee. However, if you work for a physician group, a GI group, for example, and they are going to be going to Harris Methodist, Baylor All Saints, and Plaza, those applications, the fee to those applications will apply, and usually your employer can pick those up. How long is the application? It is long. They ask for just about everything about you. If I'm employed as an RN by that hospital, do I still have to go through a credentialing process? Absolutely. If you are an RN at that hospital, you have RN privileges, but now you're asking for advanced practice privileges. You're asking for AGACNP privileges, which are very different from your RN privileges. So yes, you have to go through the credentialing process. If I'm employed by the hospital and have to do the credentialing process, does the employee health communicate results to my medical staff office? No. If you're employed as an RN and you've already had your TB test, your mask fitting, all that's as an RN, but you're applying for AGACNP privileges, the employee health does not communicate with the medical staff office. you will have to get those records from employee health to turn into medical staff office for this new application. Will the medical staff office require health records such as TB testing? You bet. They want TB testing, mass testing, immunization records. If employed by the hospital, do I have to fill out separate application for credentialing? Yes. Can I get privileges at a hospital without having a supervising physician? No. No, you may not. You have to have a supervising physician to get privileges from that hospital. What should I fill out in the application, and which privileges should I apply for? You want we'll discuss this in the next slide. What should I fill out on the application, and which privileges should I apply for? You want to apply for basic and core privileges, which includes completing HMPs, diagnosing, ordering restraints, and monitoring, rounding, performing consults, giving verbal or telephone orders, writing a SOAP note, dictating, reviewing charts, writing orders, interpreting and ordering labs and diagnostics, ordering medications, IV fluids, treatments, DMEs, sutures, staple removal, basic procedures such as suturing, starting a jugular IV, not a central line. If you want to order for ask for specific privileges, you would ask for something like lumbar puncture, paracentesis, chest tubes, intubation, caring for patients in the ICU or in the ER. There are separate privileges for those patients. Does training received in school make you competent to perform specialty procedures such as lumbar punctures, intubations, chest tube insertions, thoracentesis, or paracentesis? The answer is no. What should you do if you want to obtain those privileges? You have to follow the direction of medical staff office. So, for example, if your medical staff office wants you to have 5 thoracentesis, you must provide them with documentation that you have done 5 thoracentesis. Then they go back, you fill out the paperwork again for those specific privileges, and they go back to look to see if indeed you did that procedure, and they go look at 5 of them, if there were any complications or whatnot. And then they take it to committee. They say nurse practitioner X has performed 5 paracentesis, thoracentesis, whatever the case may be, and they have been successful at it. Here's the documentation that they did it. Here are the people that proctored them. And then the committee says, yes, they are now allowed to do them by themselves, and now we will give them privileges to do so. You must follow the bylaws of the hospital and your privileges. Bylaws for medical record completion. Bylaws on physician supervision, such as signing orders, notes, etc. You can be suspended if you do not follow the rules. If they say jump, your response to them should be how high. If they ask you to submit and resubmit documents, you do it. The first question you should always ask should be, am I allowed to do that? Do I need privileges to do that? Who are you going to call? Medical staff office. Do you need a practice protocol for a hospital-based practice? Yes, you do. Where should I keep the protocol? In most places, you should have it in your office. In some institutions, they're computerized, and everybody's practice protocols is in their database in the computer. Should I use the one you provided for me for school? That one is definitely one you can use. Some institutions have their own and want you to use that, but the one that you did for practice in school is definitely one that you can use in practice. You just have to change like the name of the practice place, collaborating physician, that kind of thing. Can I prescribe dangerous drugs in a hospital if I do not have a DEA? The The answer is no, you may not. This concludes this lecture. I hope you will learn something from it. Thanks.